Today, I am excited to have Jasmine Vializ on the podcast today. And Jasmine is all about eliminating the stress and confusion in the business of US healthcare. So, Jasmine, thank you for being on today. And I'm going to let you tell us about you because you've got so much going on that I wanted to come from you.
Thank you so much for having me. It's such an honor, honey. I really appreciate it. I really enjoy your podcast, and all of the guests that you've had on here have been very insightful, and seeing the world of billing expand is exciting. So who I am. So I have been an owner and operator of a billing company for going on 18 years now. So it's been just a little bit of time. And been in the world though for just about mid-20s years. So since I was 14 years old, so now you guys know how old I am. It's been a really fun journey. I've seen healthcare move from Stone Ages to kind of the 21st century, with the exception of some specialties that are still living in the Stone Ages. Really what the focus of our business has been over these last few years is going beyond just our client scope and the limitations that we have with our clients. And we've now opened it up to support individuals that are exploring becoming billers, or those who are working in our clients' offices and don't understand enough about the revenue cycle to support them in their understanding. So the example of that would be like the front desk, or someone who might be in credentialing who doesn't understand what the biller does, or something along those lines as well. What else did you want to know?
Okay, so you have an online course, which is super cool. But tell us how you got started. You said 14 years old.
My story is a funny story. I was actually, recruited by a provider while working at IHOP. So I've never even thought necessarily about working in a doctor's office. It had always been a passion of mine to work in healthcare. At that time, I was actually volunteering at the hospital, and I knew that at that point, I knew I wanted to be a provider. On the provider side, I never really thought about, like most people don't think about the back end, right, as like kind of a future career. And so, when he approached me, and it was really just off the basis of, you've got great customer service. Like, I think that you did a fantastic job. You should reach out to my office manager. And I kind of giggled and said, I'm only 14, dude. Like, I don't think you want to hire me. I don't think that that's a thing, right? And he was like, well, you were legally working here, right? And I was like, yeah. He's like, so then I think you could work in my office. And I went home and laughed it over with my mom and said, because I was like, do you really think that he would hire me? And, at that point I thought, there's no way. And I went in initially as marketing, we'll say. When I say marketing, I joke, it's like, it wasn't a formal job. It was like, here are the white pages, like a big old whopping book. And call some people. I was cold calling patients at the age of 14 for about, I'd say, a few months. And then he started adding in a couple of months, really. And then he started adding in other functions, because I was there in the evenings. Keep in mind, I'm in high school at the time. And so I started doing some stuff with the front desk, who was still kind of ending their day. And then as time went on, I was able to get there like right after school. And I was there for like the last 3 hours of the day for patients. And then on the weekend, they were open on Saturday. So I did all front desk, and eventually began overseeing all of the front desk. So I did all the kind of prep work and overseeing the earlier team member. And then I became the right hand of the office manager, who also was the biller. And so that's kind of how it built from there. And I learned everything that I could learn about the world of billing from Jennifer, my what I call my mentor at the time, who was the office manager. And she also was, a 30-year career biller office manager. So she knew everything, everything there was to know. Yeah.
Very cool. Okay. So at what point did you leave that job and start your own company?
Great question. So I moved from that position to another practice. The very immediate practice I moved to was actually one that I didn't anticipate moving into. I was actually there taking my mother to a physical therapist that had she had a car accident. I'm sitting in the waiting room, and they were getting a new software installed. And ironically, I knew the software. And so I'm hearing them talk about the software and hearing some things. And I'm just a little nosy. So I just kind of peeked around. I said, "Hey, are you guys getting this such and such software installed?" And they're like, "Yeah." Who are you and why are you here? At this time, I'm 16, maybe 17, something like that. And they invited me to the other side of the counter, and I became their assistant to help get the software implemented, and then eventually moved over to that position because they had a couple of locations and wanted to help, like, streamline some things. And so I did that. And then after being there for some time, I had relocated, and next place I went to, another provider, similar setup. They had multiple locations, and I basically jumped right into practice administrator role. And I was 18, which was kind of funny, because it was like, I'm still very young, and here I am on like my third position in healthcare. And it was great because that provider was super supportive about trying to get me out in the face more providers. And so he would send me to his colleagues and say, "Hey, this doc is trying to do X, Y, and Z. Can you help him with that?" And so I essentially started doing consulting for other providers while working at that clinic. And then soon after, I kind of started pivoting that to the majority of my business being, I say, consulting oriented initially, to help people get the billing off the ground. And then soon after, I decided I really wanted to move. I actually had a daughter. I had a child, very young, 21. And so I said, I need to have something with a little bit more flexibility. I'm in school and have a child now and a husband and the whole deal. So I need to actually shift things. So I moved to having them be my client. So I decided I wanted to open up a billing company. So I hired an office manager and took the billing essentially home. We'll say it wasn't exactly home at that time. Ironically, at this time, it's still, keep in mind, this is still 18 years ago. So things are very different in healthcare at that time. Yeah. And so what I ended up doing instead was, I used to go to practices offices. Like, I would spend a day here, and then I would go to them, and I would spend a day on the ground there. So, so it looked very different than what it looked like, even just fast forward a couple of years after. So, yeah.
Your story reminds me so much of my story, at least the beginning part of it, because I also had a lot of similarities when I was 18 and first job. Well, you had 3 jobs at 18. That's wild. But so you started off as a consultant and then moved into more of, having a business with employees and all that. So that's great. And you did that at in your 20s, in your low 20s.
Yes, it's so different. I remember, a lot of people talk about imposter syndrome. Like, I remember this challenge for myself mentally of like, all right, no one can tell me any different because I've got so much confidence because I'm young and dumb and I don't know any better. I'm just gonna do it. But at the same time, there was like, when I would get in front of these doctors, and it's just like, who are you and why are you here? That reaction was so different. They were kind of like, I don't understand. Aren't you like 10? It's kind of how it felt. Like, how are you going to show me anything? So it was a lot of get out there and prove myself, and try to, truly I had to do a lot of, give me a couple of months and I'll show you, type of arrangements when I first started. And so, I was doing, we'll say, a lot of, prove myself work, volunteer work at the beginning. Right. And then finally got clients as a result of great production and value.
That's awesome. It sounds like you have a tremendous amount of tenacity and confidence at a very young age. So I think that's natural entrepreneur abilities, which is super cool to see that. So talk to me about what's happened. Like, how has the company evolved over the years? I'm sure you've gone through in these last 18 years, lots of different changes. Talk to me about that, because you've got your hands on a lot of different things. So let's talk about it.
Yeah. Gosh, when I first started, as we were just saying, I was so excited about growing the company and doing all the things. And so I was thing to everyone, oh, you need help implementing HR. Great, I can help you. Oh, you need help. It was like all this minutia. And so, and there is a lot in healthcare, a lot of moving parts that, when you're new especially new providers, it's all foreign, right? They don't get enough training in school, as we all talk about. So it was great to be able to leverage my skills, but then at some point you get to the stage where I just can't manage all of this, and I'll also run a billing company. So it quickly became apparent to me, and obviously growing a team happened fairly quickly because things like payment posting was very manual at the time. So that was like the first position I hired was a payment poster, and a charge poster as well, because charges were also manual at the time. And so that was like this is busy work. This is busy work. But then once I started to grow, I thought, all right, it's fairly impossible to do all the things, right? You have to choose and focus on the revenue cycle. Like what are my strengths and how do I strengthen the business by really scaling down a little bit. And so I stopped doing a lot of the kind of ad hoc consulting stuff, people needing things like and stuff that really wasn't bringing any value to the business. Like an example of that is like insurance verifications. We had been doing those and it was costing so much money, so much time, and it really wasn't bringing much value to the business. And at the end of the day, sometimes it would almost cause more issues because now we're on the line for the information the rep told us, right? And so we're like, oh, well, you guys said, or like, well, we just put down what they tell us. So it was a little challenging to, have those conversations to get the providers to see. But once we were able to kind of say, hey, we'll train your team and make sure everyone's equipped, but it makes more sense for you guys to be able to do this. And those things didn't really come up until I was faced with like what I like to call my my first big lesson, which was when I thought I needed the big client, got to get the big client, and I had been our company had been doing insurance verifications at the time already, but, thinking like, oh, well, between 10 and maybe 20 a day was a full plate for someone that's doing, verifications. But we bring on the big client and they've got 9 locations, and it was like, in a week, there's like hundreds of verifications. So you have like a team of people doing verifications. And so that it came along with a lot of pain to kind of commit, because I like to say I learned the hard way to not be a yes girl. I was like, yes, I can figure it out. And then, literally I'm working 24/7 and paying other people to work 24/7 basically, because we had, that much work at the time. And so, it was a hard lesson because it's not sustainable. It's not sustainable.
So where are you at right now? What's your focus? What's your niche on the medical billing side? What are you focused on?
Yeah. So we are focused primarily on spaces that I'm really passionate about. So for me, that is the mental health space, behavioral health and mental health, that can really help kind of support the emotional well-being, sometimes the overlooked aspects of the human. And then also what I believe healthcare is moving towards, which is the FQHC market. So federally qualified health centers, the underserved, and unfortunately, the most affordable way to access healthcare from a whole person perspective without having the barrier of cost. Because if you're familiar with FQHCs, they have if you're completely uninsured and wanting to pay out of pocket, they're on a fair sliding fee schedule option that is very different than what our traditional practices are allowed to do. We'll say when it comes to payer contracts and things, they have a lot of passes on different, we'll say, easier ways of behaving in a patient-provider relationship when it comes to finances. So
right, yeah, absolutely. I think the FQHC is a great niche. Do you have a favorite software that you like, or a few of your top favorite ones?
Good question. No, I don't. I don't. I would say I could pick apart every one of them. There's nothing out there that's perfect. The challenge with some of the systems is they've done a good job at trying to make a function isolated to just what that function is. So like if it's a work queue for someone who's doing follow-up, you have a follow-up work queue, right? And it feels like, okay, I've got my work list of things I need to touch. I also think that it automatically, just in the nature of everyone kind of adopting a similar mindset of a hospital system, it automatically creates those silos, just like hospital systems have, that people don't understand what goes on in the other aspects of healthcare. And that poses challenges when you're talking about the revenue cycle, because you really need to know the entirety of the revenue cycle to make even what you're doing in a very isolated space effective.
Okay. So if a client comes to you like a brand new doc and he wants to get set up with an EHR and a billing system, would you give him a list of your favorite ones, or would you just have him figure it out?
Yeah. So I don't like to say yes to certain systems. So I have my no list. We'll say ones that I will not take on at all. Just because they don't support what we do in the revenue cycle. And even though the EHR might be spectacular, every other aspect's not so great. But yeah, I mean, I would say there are some really great specialty systems out there. Like my number one that I think we really like a lot is Modernizing Medicine, or ModMed. Those guys have figured out a way to also, niche down to think about what the needs are for EHR, for specialists, and not try to be everything to everyone like the Athenas of the world. It's a little challenging, or the Epics as well. I think that both Epic and Athena have enough skin in the game that they have plenty of experience. The challenge with an Epic environment is that like Epic is getting into a lot of other areas of specialty. The challenge with those guys is their implementation is very painful. And so you have to have enough money in the bank to sit for, weeks or months of very rocky revenue streams. And so most practices, are not capable of sustaining that kind of environment. Athena is a little better because they are applying kind of cross stream logic from like other accounts. Epic tries to do custom builds for pretty much every type of client, and it's challenging for them. And I feel like it almost makes you feel like, why would I want to buy an empty shell like that you're going to need to build, the land is great, but if I could buy a house that has the bones, really great bones,
Right.
I'm happier with that. So,
Right.
so yeah.
Awesome.
What about
Okay,
you? Do you
cool.
have a software that you like to recommend to people for like starting?
I have a short list of the ones that I think my team really likes, and it's easy to use and good reports and good customer support. I like Advanced MD. I like Care Tracker, like Harris Care Tracker. I mean, it really does depend on, a lot. A lot is on the provider and the front desk, because if they're not using it properly, right, you have to make sure that they're adopting it and using it properly. So it has to be like usable and friendly to the front desk first. And then I think the billers could adapt, because, with billing, it's the same information. It's just, we all have, systems that we feel like are better than others. And I think a lot of billing company owners always have this like grass is always greener thing, because when you pick a software, most billing companies stick to one software and they're like, I don't want to work with anything else. And then there's billing companies that will work off of anything, and it's really difficult for them to scale. So I think a common question that people are always wondering is, I wonder if I picked the right software. I wonder if there's a better one out there, right? So I like to ask the question, just you've got so much experience. Let's shift gears for a moment and talk about you've been in healthcare for a long time, like myself, but tell me, what do you see for the future of healthcare? Where do you think things are going?
I leaned into FQHC because I do believe that the US we're ballooning and we're going to continue. So it's going to get to a point where things are going to get very messy when it comes to, it's already has. And everyone in the billing world is like, oh, it's such a task with appeals, and it's such a task with denials and things. And it's never going to go away. It's going to get a lot worse because the payers themselves are having challenges, meeting the expectation of the reimbursements, especially, with advancing age and just the general state of the well-being of our country, especially as a result of such a traumatic event that we've just, are all coming out of. There's going to be these repercussions, we'll say, as a result of that, where, the healthcare expenses are going to continue to climb. And so what happens is in the end of that is that, people don't have the money, they're not able to afford the proper healthcare that's needed. And the government eventually also is going to have challenges, we'll say, with being able to sustain that from a full coverage perspective. So it needs to be a balance between, if I have no insurance and I want to pay out of pocket, how do I make that affordable? And then on the other side of that, if there's an insurance involved, how do we make it a little less complicated? And so in short, the single payer method, it's not a pretty system, but I think that I 100% believe that the whole FQHC concept is the government's way of testing the single payer system, for them to be able to control a lot of the cost from the perspective of they're able to evaluate outcomes properly, because we have all seen, supposedly what the value of the initial impetus of PQRS and, the physician reporting and things to be able to increase what the value of the patient outcomes, but it's messy. MIPS is not a pretty thing, and it doesn't produce much value. And really the reimbursement model has been, evolving, but it's not going to evolve into having providers stay. It's going to evolve into providers choosing to leave the payer system because of that control factor over their business. So you'll have this kind of dichotomy. It'll be all the providers that are going to go to self-pay, where they can have control over a concierge model, and then folks that are just going to dive into what will be an easier, cleaner model where there's just one person that they're dealing with. So that's what I see. And when it comes to billing, everyone's always asking, well, how does that end? What does that mean for the billing aspect of it? And just like other countries that have single payer model, it doesn't eliminate anything that billers do, because there's still an aspect of billing. I often, with the YouTube community that we have, I often get questions from New Zealand or Australia and other countries that have adopted systems that are similar. And it's, I'm I don't know anything about your payer system directly, so don't take any of my advice. But I would say that, in general, the complexity is there. It's just not, it's not as messy as what we've created here, and a monster of a system that most people don't even understand. Even people that are working in the insurance company don't fully understand their function.
I think it's really interesting what you're saying. And I mean, it seems to be, an interesting concept, but FQHC, a federally qualified health center that is in certain areas, right? The federal government only approves certain areas that are underserved. Correct me if I'm wrong here. Mm-hmm. And it's a mostly Medicaid population, correct?
They're a mixed bag. So they actually are required to have commercial carriers as well. So there is a funding. The funding goes only to the folks that are completely uninsured, but you have to have you're required to serve a population that's more balanced. So there are a lot of commercial paying patients as well. And there's also, of course, a large number of uninsured and patients that are just paying out of pocket for services. And they're all multidisciplinary. They have to have services like dental, behavioral health. There's aspects that they're required to have. And so the model sees the whole person in a different way than what a lot of healthcare is, which is quite siloed. It depends on the motivation from your provider to continue to make sure that you are sticking to the recommendation of the plan, right? It depends on most providers have have no requirement to prove to anyone else that they are following up with you, that they are actively communicating with you. And FQHC have all of those requirements built in, like when they're doing their annual reports and when they have their audits, they have HRSA audits every year, and then they have Medicare cost reports that they have to provide very, very detailed information on an annual basis. So every single month, they care about the quality and the quantity and the value. It's not just kind of like a forgotten thing until things don't work, which is typically what happens in a private practice setting.
So let me ask you, how does a patient know if they're going to an FQHC? Like from the patient side, if I'm a patient and I want to go to an FQHC, how would I know that?
So there is a way to search for an FQHC. Most patients don't necessarily know unless they understand the languaging of that first visit, or the intake typically is different. They will announce that they have, if they're uninsured, they have the ability and access the sliding fee scale, which last year with the rollout of our surprise billing kind of, does a little bit of a change in there's similar aspects of the language, but the way that the initial intake takes place is usually a good sign. And the typical language for we'll say the branding is usually health center is in the name somewhere. But there are a lot of hospital systems across the nation that have birthed health centers, and they all have unique names, and they're not necessarily, it's not obvious that they're federally qualified. Or that they're not. There's this concept of lookalike, which is going to get too much into minutia, but they might have the ability to essentially function just like an FQHC and still have a very common name. And it is all around, whether they have, it can support enough patients. They have to have the right kind of mix of providers. They have to be able to, as I said, prove that they can, pass an audit. The reporting that's required has to be produced, and there's some requirements before they can even apply. So you have to basically have a lookalike status, we'll call it, before you can even apply to be a federally qualified health center.
Okay. For those that are listening and that are curious about starting an FQHC, because I've had a number of clients approach me and say, well, I think I want to open an FQHC. What I heard you say is they have to offer dental, they have to offer behavioral health. Are there any other things that you know of that they need to offer?
I wouldn't be able to list all of the specific requirements off the top of my head right now. But I would suggest there is an organization that I 100% support. They are the people that you need to go to for anything FQHC when you're trying to figure it out. It's FQHC.org is their name, is the company name. And that whole website is devoted to, I'm trying to figure out what to do if I want to be an FQHC or lookalike or anything like that. Yeah. FQHC.org. Yeah. And those guys even do consulting if you're trying to walk the path of becoming an FQHC. And they will kind of give you all the long and short of like, yes, you can, or no, you can't. And here's why. So it's somebody that I would point at those guys for any specialized knowledge there.
Perfect. No, this has been really helpful and very, very insightful. Okay. So I want to talk a little bit about offshoring. What is your take on it? And I know you've done some of that before. Talk to us about your thoughts about offshoring.
Offshoring has been in my life for a bunch of years now. I think it's probably been 12 years since we started offshoring. Huge part of that goes to our economy shifting and the cost. I mean, keep in mind, I should mention this for listeners as well, that I was in the DC area when I first started my company. So if you've ever visited, been around, lived in the DC, Washington metropolitan area, you know that it's expensive. And so it costs a lot to live there. And so obviously hiring individuals in that area are costly. And shortly after, let's say, technology met us, where we were able to have team members in other areas, it made it possible for me to hire folks in other states. So that obviously helped to bring costs down. But the truth is that when you look at a function like payment posting that is so different in all different softwares, where some of them work beautiful and it loads everything great and everything is where it needs to be and all the information is present as far as the reason for denials, it's awesome. And then you have other systems where it doesn't quite work. You got to finagle with, correct the auto posting features and things like that. A lot of human intervention. There really is always going to be someone involved in that process. And it's a huge volume of the work when the practices are larger, right? And so the reality is there's not really any ROI for that individual. Yes, the effectiveness of posting is important, but you're not able to squeeze the orange that's already squeezed. It's like it's already there. The juice is there. We're just like make sure that it's in the right cup. Like that's kind of what the purpose of that function is. And so the bottom line is that was the first function that we were like, we got to get this offshore. Like we have to get this to cost as least as possible. To make sure that we can focus our efforts and energies on the things that are going to produce results for our clients. I mean, at the end of the day, the majority of us are, for the most part, having some kind of a commission type structure that's involved. And so the goal is to bring in as much revenue as possible for those accounts, with taking into consideration all of the different contracts and things that they are billing for. Some of those, there might be a little bit more of a requirement to have like follow-up team members and coders and, folks that are highly qualified in a specialty versus having someone that is doing something like a payment posting or a charge posting. And then so we did that payment posting feature function first, and that lasted for a while. I think our first rodeo was really bumpy. It was like, I learned quickly, as a matter of fact, that was my lesson in, you need like heavy documentation on your protocols. Yep. That was our first lesson, because at first, you thought you had it that tight, but then you realize, okay, that is something that we've assumed because someone who's payment posted for a while knew that was the process, right? So there's knowledge that kind of is built over the course of time, that when you are trying to get it to an offshore team that's trying to follow your protocols and your processes, you need to be able to measure like the effectiveness of that. And so you need to set up the qualities and controls, and you can't have the quality and control aspect if you don't have a clear process to start. Like, what are we checking? What are we measuring? So initially the payment posting was bumpy. We left the first company after a couple of years because it was like a family owned company. And then there was a lot of shift and change. So we went we'll say we spun off with someone that was a part of that company into another organization. And thankfully that was super successful and loved them like so much. And then that kind of time ended because we lost a lot of our leadership team at the time. And during the time we were with the second company is when we started exploring other things like our claims process. That was the next thing for us. It was trying to evaluate, how do we make sure that claims are going timely, that there's a little bit of human scrubbing where we need to have the code scrubbing that is not kind of built in a robust way in a software. How can we create a process that we can offshore? And so that's what we did next. And the very last function we brought to the offshore team was AR. And that, for like the life of me, has been the most challenging. However, right now we're very pleased with the company we work with. It actually, we moved other things to them first, and we kind of like left that because they were not specialized in AR. They'd done a lot of other functions. And so we were trepidatious to say like, okay, but we developed them a lot and we're very happy with the results, and things have been amazing. And since the last few years, like it's expanded, like our offshore team does a lot for us. Like they are a huge part of the quality process for us as a company, not just over the function. Sometimes they have quality over production for offshore teams they should anyway. But we have, they quality and check, reconcile and quality all of our stuff for a monthly basis for our clients. They are doing, all of our month end balancing and reporting for our clients. So when I get it, it's in a beautiful package that's pretty much ready to go. And there's a second process that that our team looks at before we do the invoicing and such. But it's a smoother process to have them involved in it. I even have them leading a lot of our client meetings, depending on the client relationships as well, because I have the team leads, or the other people may call those account managers, on our offshore team as well. So it's been, we'll say, a long journey, but a really beautiful one. A lot of good fruit, and we love our team. They're a part of our family, so it's very important to us to treat them well.
That's really nice to hear. And that's in India, right? They're all in India.
So we have India, we have Pakistan.
Oh, okay, nice.
Yep. Yeah, too.
Great. Yeah.
I haven't really done a lot of work in the Philippines. I've entertained the Philippines. I just always felt like they were overpriced, and we don't do any customer service calls or anything like that, offshore. I just have never had great experience with that as a consumer. So I just would never want to do that, as a company. So yeah, so I've never done that, but I know a lot of people do that with the Philippines, and I've been, hearing a lot about nearshoring, as they're calling it, which I think is a funny term. It depends on what country, what part of the country you're in, if you're near my shore, but yeah, there's a lot of Latin American countries that are getting into the game. And I could kind of see that those countries will definitely be more useful in the areas of customer service for bilingual needs, especially those practices that have a large Spanish-speaking population, or even French-speaking.
Yeah, absolutely. What do you think is an ideal ratio of American to offshore? Do you have a number in mind of?
That's a really good question. I would say, there's always way more on the offshore team than there are on the American side. It's going to depend upon the client, but the ratio, I guess, would stay about the same for something like an AR function. And that's more I'd say even 1-4, 1-5, for an offshore for something like AR, because, accounts receivable or follow-up, because those functions are going to require some specialized knowledge, but typically if we have a team lead that's effective, that individual has the ability to kind of nurture and mold the team in the way that they need for those clients, right? And so, yeah, I'd probably say something like 1-4 or 5, depending on the function. Payment posting, we don't do any, we don't have any payment posting or claims functions here. All of our rejections are managed by our team offshore. We don't have, so I would say that's probably one to many when it comes to that.
Awesome. Well, it sounds like you've really created a lot of efficiencies. What do you think is your unique ability, or where are you spending most of your time these days? I know you're a busy mom, you're a yoga instructor, where are you spending your time?
The yoga instructor is always like, what? A yoga instructor? Even when I say it, it's very funny. Yoga saved my life from mania. I always tell everyone that. I was in the midst of, it was actually during that big account that scared me into saying no. It taught me how to say no. That I was losing my mind and very, very stressed. I was, my late 20s and thinking that I'm, going to have a heart attack before I'm 30. It was very, very stressful, and yoga was the thing. So for me, I actually did the yoga teaching training just so I could learn from my teacher. That was why I did it initially, but I realized I loved it. And not only that, I enjoyed the prospect of showing and sharing yoga to other people that are like me, women of color, people without the typical body types, the typical look. That was really important to me, to bring it into a community that usually we were not as commonly represented. I would say it's shifting and changing, and it has been so beautiful to see. But for me, yoga was always a really great gift that I wanted to share with others. And so the yoga teaching, I have a business, a separate business that is doing amazing work in the Charlotte area. But I'm not the teacher for all the classes. I don't have the bandwidth for that. I have an entire teaching team here.
You own a yoga studio, but you don't teach, you hire the teachers and you run this whole yoga business on the side. I love this because I'm a yogi and I'm totally with you. It's a sanity saver and it definitely keeps you grounded, but that's amazing. Okay. So you have a yoga studio, you don't teach, but I'm sure you're pretty involved and I'm sure you attend classes, right?
Yeah. And I teach from time to time. There's certain classes that I'll like jump into, but it's better for me to not feel bound to a regular schedule, considering that I have, the other business and the aspects of that business that need like tending to. It's like it's like rejecting the first child for the stepchild kind of thing. It's like, like you can't do that. You got to nurture all things. Right. So important to me to keep things, balanced in that way. And it's been a really cool journey. But you mentioned you had a question though about what's my focus right now. So our number one thing in healthcare side is really supporting those folks who are coming into the world of healthcare that don't know what they're doing. So it started out as a pet project with the YouTube, and it's turned into this whole other world of amazingness where people are just like, they're just finding what they need, whether it's like support to help them into a position. It's all the stuff that we thought we could have used when we first got into healthcare. Like if I could just reach out to someone and find out the answer to this question, or do I really want to do that job? Like I got this offer, but I don't even know what it is, so giving people a peek, because our world is a mystery for most people. Like everyone's going to the doctor and nobody knows what happens after you leave the doctor. It's like someone called me and said I had a balance, but I have no idea why. And so all of this stuff on the back end is what we are teaching folks and helping to shorten the learning time from the moment someone decides to switch to a different role in a practice and says yes to credentialing. For example, as an office manager, it's a common thing where someone might be offered a position to do credentialing and then kind of moving down the line of taking on the work. Like, why did I say yes to this? But they have no idea. There's no real direction for them and nowhere for them to go and say, here's some information superficially about the process so that you can decide. And then if you want to go deeper, here's an actual course and a path that you can take to educate yourself fully to feel, adequately trained in the function.
Okay. So tell us, where could we find that? Where could our listeners find that course? Where do we go?
Yeah. So the best place to go is, best place to go first is on our YouTube channel. So Inlera University is definitely a place that you'll want to visit. And then our company just rebranded recently to Inlera University. So IPS Learning Institute is our other sister brand. And that's where the website of the landing page is right now. So IPS Learning Institute. And then anything on YouTube to give you a sense of kind of what our content is and our audience. And yeah, that's a lot of that.
Awesome. And you're still taking FQHC and mental health clients right now?
Yes, FQHC, mental health primarily, yes. And when I say FQHC, there are a number of specialties under there that we could and would accept that are under, if you look at the umbrella of FQHC specialties that we would consider. It just depends on the region of the country and software, as we were talking about earlier. We're not saying yes to all software, so got to be selective these days.
Got you. Okay. This is so nice to have you on and so enlightening. Tell us where can people find you if they want to connect with you?
Yeah, best place would be LinkedIn. My name is Jasmine Vializ, V as in Victor, Ializ, and I'm the colorful one with the purple background forever. Find me on LinkedIn. And then and the YouTube is also a great place if you're just looking for content and want to learn a little bit about what we do and how we do it.
Okay, we will put a link in the show notes. Thank you so much, Jasmine.
Thank you. I appreciate you, honey.